I remember growing up, looking in TV and being like, wow, look, they're doing like, mission work and they're helping people. And like, I was like, that could be cool one day, And all of a sudden, just because of life, I ended up being friends with Simon, with Juan, and now ORCAA, and I got invited, my man. And it just turned into this, and I'm blessed to be part of this and being able to help people that, don't have the resources, but they have the need.
What's going on, everybody? John Stamper. We are here live in Las Vegas. It is the second annual ORCAA Symposium. It is day one, and we're going to keep these conversations going with these incredible clinicians. Like I shared with all of you, I think what's very unique about this symposium is 22 countries represented. And so very excited for our next presenter, Dr. Nestor Marquez, who actually practices in Mexico.
Yeah.
And just got off stage. The Empire State concept is what you talked about. But before we get there, what's it like to be here, man?
It's great, man. I felt like I just got off stage and I'm like starting to sweat basically, I was like probably starting to breathe, but it's great, man. It's great. The people are great. It's like we're all the same type of people. Like there's everybody's great.
Yeah, I love that. So let's talk a little bit about the Empire State concept, like what you talked about, just a couple of the highlights of your presentation.
Sure. Basically, it's a stepwise or a multi-layer preparation or osteotomy for implant placement, We're all trained, or our beliefs are like, follow your drilling protocol or sequence, But certain cases, and mostly atrophic cases, which is what ORCAA is great for, remote anchorage and all that, require extra technique. And Empire State concept is just a technique that amplifies our ability to gain primary stability.
Okay. And so for a doctor that's watching this, talk a little bit about the learning curve of that technique.
Yes. There is a learning curve. I've always said, start simple, start knowing the bones, start knowing what you're doing. I said it on stage. I said, hey, man, a lot of doctors are starting, and you scroll through Instagram and you're like, I want to do that. And they try it, and you didn't take the right course. Yeah. You didn't come to ORCAA.
Yeah.
And they miss certain steps. Empire State concept is a tactile algorithm. So there needs to be experience behind what you're doing for you to feel the bone as you're drilling into it and be like, whoa, man, this is a type 4 bone where I need to be careful with my drilling sequence.
Yeah.
Instead of like, it's bone.
Yeah.
Second drill, third drill, you place the implant, no torque at all. Because there wasn't this experience-based algorithm that downloaded when you hit that first initial drill.
Nestor, why is that important with a lot of the patients, with the work that's being done with the edentulous patients in Guatemala and that? Like, why is something like this technique so important?
Because it allows us to treat the atrophic cases or the hard, complicated cases in an easy way.
Okay.
So we've taken actually the Empire State concept to ORCAA already. I've done, last time I went, we did about 50 something surgeries, and there was cases that we saved from going to a more aggressive technique, like maybe a zygoma or something like that. And we kept it, I always like to say we keep the zygoma for a plan B. We always as surgeons have to plan to fail.
Right.
It's always in the back of our mind. The zygoma for me is that, we'll save it for later. Let's try these techniques, it's a wide variety. That's why there's a course that's called The Ways of the Arches, which I teach.
Right.
And in that course, we explain there's a lot of techniques that you can try before you go into remote anchorage. So.
Can you talk just a little bit about ORCAA, the organization, this symposium, the work that they're doing, kind of this mission of helping, as many patients as they possibly can?
Yeah. I remember growing up, looking in TV and being like, wow, look, they're doing like, mission work and they're helping people. And like, I was like, that could be cool one day, And all of a sudden, just because of life, I ended up being friends with Simon, with Juan, and now ORCAA, and I got invited, my man. And it just turned into this, and I'm blessed to be part of this and being able to help people that, don't have the resources, but they have the need.
Yeah. What are you most excited about when you look at the next couple of years? I think both in dentistry, but in a lot of the work that you're doing, what are you most excited about?
Great question, man. what am I most excited about? I'm excited about my wife having a third kid right now.
Congratulations.
And
Like right now?
like, well, no. She was here listening to me. Like, whoa, by the way. Oh no.
I love it. Yeah.
No, she's pregnant,
Yeah,
and
yeah.
I'm excited about that. In my profession, I'm excited about teaching, sharing with whoever listens, these techniques that have saved me headaches, and stuff like that. So I plan to keep doing it, as long as I'm alive and the man upstairs gives me life. So
What's the environment right now with a lot of dentists wanting to really lean into this? Like, are you seeing that more and more
Yes.
are wanting to learn some of these advanced techniques and kind of take their dentistry to the next level? Like, are you seeing that more?
Absolutely. I think, and I'm happy for it, and I'm happy to be able to be someone they can like learn from, and I can teach what I know, But yes, absolutely. Like, I think, I'm not sure about the logistics of it, but in the past few years, everybody's doing full arch. Everybody's doing these things, me, Juan, Simon, Eldad, everybody that's a part of ORCAA, we just want them to do it right.
Yeah.
And if there's a seed we can plant for them to start doing it that way, through several techniques, through a correct zygomatic placement, you'll hear all about it, through the Empire State, then that's what we did.
I love it. Well, congrats on everything, man.
Thank you, man. Thank you.
Pleasure to meet you. Good luck on the third child.
Thank you.
Excited
She's
to
right
hear
there.
how that
She's looking
goes.
at us. Yeah.
I love that. And enjoy the rest of the symposium.
Thanks, man.
All right,
Thank
man.
you. Appreciate it.
Yep, you got it.
Sweaty hands.
All right,
Sorry.
you got it. Yeah.